My name is Mara Sparrow. I did my Anatomy and Physiology 2 lab disease project on asthma. An interesting fact I learned about asthma as I did the project was that it can double the risk of a cardiovascular event like a heart attack or stroke. I'll be explaining key points and lots of information about asthma throughout the video. Some common symptoms of asthma are coughing, wheezing, shortness of breath, chest tightness, other breathing problems, and increased heart rate. People with asthma may also experience rapid breathing, frequent respiratory infections, or difficulty sleeping. Typically, people with asthma do not show a major progression of the disease. Normally, if a person has asthma as a child, they will most likely have it their whole life. But it's possible to outgrow or undergo remission, which is a decline in the symptoms of a disease, during adolescence. When in remission, asthma can be inactive, or the person could relapse, which is a reoccurrence of the disease in mid-adult life. In order to see if a person has asthma, certain tests have to be administered. The first one is a simple examination of the patient's nose, throat, and upper airways. The use of a stethoscope is necessary when listening for any abnormal breathing patterns or wheezing. When listening for wheezing, it usually sounds like a higher-pitched whistle noise, which is mostly heard when there's an exhale. A spirometer can also be used as a test for asthma. A spirometer is an apparatus shown on the slide that measures the volume of air in the patient's inhale and exhale. Some other less commonly known tests include the peak flow test. The peak flow test measures how quickly the patient can blow air out of their lungs using a peak flow meter, which is similar to a spirometer. Another test is a trigger test. This test tests how sensitive the lungs are. The medical professional performing this test will expose the patient to a specific asthma trigger to see how the airways react. Then the patient will be instructed to breathe into a tube that's connected to a machine which measures the amount of nitric oxide in the patient's exhale. This test is also called an FeNO test. It is difficult to diagnose a person with asthma before the age of 5, and previous medical history is necessary to use for the evaluation. The diagnosis is easier to make a little later in life. Some common risk factors of asthma include infections such as a cold, the flu, or upper respiratory tract infections as a child, allergens like pollen or air pollution, smoking tobacco and being exposed to either first, second, or third-hand smoke, cold air or extreme weather changes. Asthma is also genetic and can be inherited from family members who have asthma themselves. According to the CDC, if a child has a parent with asthma, that child is 3 to 6 times more likely to have asthma themselves, and 3 out of 5 of all asthma cases are inherited. For this slide, I'm going to explain the normal physiology or function of how breathing works. During a normal inhale, the diaphragm contracts and moves downward, then the external intercostal muscles between the ribs contract and move upward. The thoracic volume in the chest increases, but the intrapulmonary pressure decreases. The intrapulmonary pressure is the pressure inside of the lungs, and it flows down the pressure gradient until it's equal to the atmospheric pressure. The atmospheric pressure is the pressure in the air surrounding us right now. During a normal exhale, the internal intercostal muscles between the ribs relax and the lungs recoil. The thoracic volume in the chest decreases, but the intrapulmonary pressure increases, then flows down the pressure gradient until it's equal to the atmospheric pressure. Hormones produced by the body, including epinephrine, help to relax the muscles around the airways in the lungs, dilate airways, and block smooth muscle constriction. The smooth muscle around the airways controls the diameter of the lumen, which is the space of the airway. There is also a mucosa layer that has glands which secrete mucus to keep the airways moist. The bronchioles, are the smallest part of the lungs, and their role is to create an air passageway between oxygen and carbon dioxide that can be exchanged. The sympathetic nervous system dilates the bronchioles, but the parasympathetic nervous system constricts the bronchioles of the lungs. Pathophysiology is the abnormal function associated with a disease. In this slide, I'm going to explain the pathophysiology of someone having an asthma attack. When a person is experiencing an asthma attack, the smooth muscle layer constricts or tightens the bronchioles in the lungs. The diameter of the lumen in the airways becomes significantly decreased. The mucosa layer swells up due to the inflammation from the trigger of the attack, and this causes further clamping off of the airways. The glands in the mucosa layer secrete excess mucus into the lumen, causing the diameter to narrow even more. Small bubbles form in the lumen, which is the cause of the popping or cracking sounds that are heard when someone's having an asthma attack. The gas exchange between oxygen and carbon dioxide that normally happens in the bronchioles cannot occur properly, and it's another reason for the abnormal breathing. These abnormal functions will lead to the symptoms of asthma. There's no cure for asthma, but there are some common treatments that are used to manage the symptoms, including inhaled corticosteroids or inhalers. Inhalers work by preventing certain cells in the lungs from releasing substances that cause inflammation. Glucocorticoids and mineralocorticoids are inhaled from the inhaler in order to stabilize lysosomes to reduce inflammation of the lungs. An inhaler can be used by putting your mouth on the spacer, then pushing down on the tube on top and breathing in for around 3 to 5 seconds. Some advantages of using an inhaler is that it's a fast treatment option that allows quick relief and improved lung function. Some disadvantages of using an inhaler is that when a person inhales the corticosteroids, it can be misplaced if the mouth isn't fully around the spacer. There's also a small amount of corticosteroids that comes out with one puff. Inhalers will not relieve an asthma attack once it has started. Bronchodilators are another treatment option for asthma. They can be used daily, and the inhalation of steroids can prevent asthma attacks in the future. A nebulizer is a treatment option that's a machine that pumps medication out as a mist directly into the person's mouth. The person can hold the tube up to their mouth and breathe the mist in. A nebulizer can be prescribed if someone has a difficult time using an inhaler properly. Some advantages of using a nebulizer is that it can be easier for younger children to use, and it involves higher doses of medication than an inhaler does. Some disadvantages are that the dosage process takes longer than an inhaler. It takes around 15 to 20 minutes to sit with the machine in order to receive the proper dosage. Nebulizers are also more expensive than inhalers. The last 2 slides are my references that I used for my information in the project. Thank you for listening. I hope you learned some things about asthma that you didn't know before watching this.